Travis County leaders are once again sounding the alarm about the increasing number of overdose deaths in our area. But now they say they're focusing on a group that needs more help.
Yeah, and that group is people leaving jail. KXAN's Grace Reeder breaks down the data behind that new focus.
I don't know about your family, but in my family, addiction's been really mean.
Looking at the most recent medical examiner's report, Travis County found nearly a quarter of people who died of accidental drug overdoses in 2022 had been in jail at least once the year prior. In other words, county staff say people leaving jail are 8 times more likely than the general public to accidentally overdose and die.
The data also shows that a person who enters the jail is at the highest risk of dying from an accidental overdose death in the first 30 days after they leave the jail system.
What do? Jail is not the answer.
We talked to Joy Giles earlier this month as she begged the county to provide families like hers more resources. Her son Miguel has been in and out of jail, and Giles told us he has a mental health illness and issues with drugs. We spoke to Miguel Tuesday, shortly after he got out of jail. We asked him about the numbers. And I wondered, with your experience, if that surprises you.
No, that doesn't surprise me at all.
The county says working with people who have lived experience like this family's is one of the keys for what comes next. The sheriff's office is now looking to up the number of Narcan doses they hand out when people leave the jail and better connect people with health care after they leave.
Expanding the resources available to individuals leaving custody and better connecting them to ongoing services to sustain their recovery is what will make a difference and save lives.
Grace Reeder, KXAN News.
Travis County is also working on a mental health diversion center right now that they say could help with this issue. It would divert people to treatment for mental health and substance use issues instead of putting them in jail. Going in depth now, this isn't happening in a vacuum. According to the National Institutes of Health, some research shows an estimated 65% of the U.S. prison population has an active substance use disorder. Another 20%, while they didn't meet the same criteria, were under the influences of drugs or alcohol at the time of their crime. And inmates with opioid use disorder showed a higher risk for overdose following their release.